Everybody, welcome. It's Dr. Brown from KNS Chiropractic, your Baltimore area chiropractor. Today what we're going to talk about is how we treat somebody that has TMJ, pain in the jaw. So let's get started. This is Kimmy. Say hi.
Hi.
All right, so Kimmy's coming in today. She's got pain in her left side of her jaw. We call that her temporal mandibular joint, her TMJ. That is where the lower part of your skull attaches to your jawbone, your mandible. Right in here there's a joint called your temporal mandibular joint. What happens is, and what's going on with her, is she has very limited mobility in her mouth. She can't open her mouth well right now. It's very tight and it's very sore and very painful. Now, why do people get things like this? They get it being at the dentist, keeping your mouth open too long, sleeping in a bad position, putting pressure on your jaw, people that clinch at night, people that have a lot of stress, clinch down. It can come from grinding your teeth. Whatever it is, she has very limited mobility. But what's going to be really awesome today is that after I do this treatment, you're going to see she's going to be able to open up her mouth very, very well, and she should have less pain. She's also getting some clicking in the jaw, and I'll explain to you what's going on with that. But let me show you. Kimmy, open your mouth. It's very limited. Come over here. Now, show. Close it. Open up again. Okay. So she's got very limited mobility in the jaw. We already had, that's good. We already had Kimmy on electrical stim, and the electrical stim helped to relax the muscles and take some of the pressure off of what's called your masseter muscle here. Now, we're going to work this side of the jaw. So what I'm going to do is some manual tissue work. I'm going to get in here. You've got two muscles that attach into this jaw. You have your temporalis muscle, which comes down here, and you have your masseter muscle. That's responsible for you to opening and closing your jaw. Some little accessory muscles too, but these are the two that we're going to focus in on. So what I'm going to start doing here is we're going to get in here, and it's a little painful, and I can feel how tight it is, but this is going to help to break this up. She's very tight. This masseter muscle is very, very tight, so it's keeping her jaw clenched shut. And I'm going to work some of this tender, right? Mm-hmm. And it's very, very painful. And we're going to work across this muscle to try to break up these fibers, to try to break up this area that's irritated. I'm going to come over here and do it with this hand. And we're going to work some of these. And it's real tender for her, but it's really going to help to get the pressure off here. We've got to make sure she gets good mobility here. And I'm going to show you something with this joint. It's really tender, right? Mm-hmm. And we see this a lot. We treat this a lot, and we have a great treatment for it. And it works wonders. And she will have good mobility by the time she leaves here. So what we're doing is we're getting here, muscle goes in this direction, and we're working against this, trying to break up some of these tight spots. So look, you got her mandible here, lower part of her jaw, top part of her skull, and it forms this joint, a TMJ. So it's like, this is the lower part of the mandible, this is the lower part of her skull, and it fits into this joint here. And inside here is a little disc. And this little disc keeps it so the bones don't rub on top of one another, and it's a little piece of cartilage. And the joint should glide back and forth like this. If the muscles are tighter on one side than the other, let's say they're tighter on this side here, what it's going to do is it's going to shift. You watch, got this, Nat? Mm-hmm. It's going to shift this over. When you shift this over, that disc moves out of place, and that's not good. It should move like this, and on her it's shifting over. So as this shifts over, this causes people get popping and clicking in their jaw when they try to open it, because it doesn't track straight. A normal jaw should open straight. If my muscles on this side are tighter, it's going to take my jaw and pull it over to the side. We don't want that, and that's what's going on. This side is really tight. She doesn't have any pain on this right side, so we're going to work this and try to get this loose. So I'm going to do this for a little bit longer, and I'm right on this muscle, and I'm right on these tender points. And after this, what we're going to do is we're going to do some progressive resistance type of exercises, which will help get her better mobility. You all right? Mm-hmm. It kills. Mm-hmm. And then we're going to adjust this. So this is what we're going to do. So she's very limited. Open your mouth a little bit. So she's going to open her mouth into my hand against resistance. And what I'm going to do over the next couple of weeks is show you a video on things that you can do in your home at home to see if that'll help you too before you go to see somebody. Relax. Do it again.
And we're going to open up wider and wider and wider here. Relax. Do it again. And she's just going against resistance, and this is working this muscle. Now also, we're going to wind up adjusting her neck. Relax. Because all the muscles from here go up into the jaw. Open your mouth a little bit, as much as you can. See, it's tight, but better. So now what we're going to do is we're going to go to this side. So I want you to take your lower part of your jaw and push it into our right hand. Relax. Do it again. Relax. Now I want you to open up your mouth for me as much as you can. Let me see how that looks. Shut it. Do it again. Okay, a little bit better. So we're going to adjust this now. And I'll show you how we do this. And she's going to have really good mobility in here. We're definitely better than it was when she walked in. Sore, huh? Mm-hmm. How did you wind up irritating your jaw?
Grinded my teeth too much.
So she grinded her teeth a lot. Grinding your teeth, you're keeping it clenched, so the muscle gets tight. When the muscle gets tight, it starts to pull everything over, and that's what's going on. Mm-hmm. When you clinch and you get tense, it's exactly what we see. So, just right there in that. All right, so now what we're going to use this instrument. And what this is going to do, I'll come over here. This is going to help to adjust the jaw. We want to make sure the jaw opens up and tracks straight. This is going to push it into place, and it's also going to take that disc and make sure that disc gets into a normal position. So Kimmy, open your mouth for me. Okay, shut it. And this just provides a high velocity, low amplitude thrust into the joint, which helps to realign it and helps to break up the muscle spasms that are keeping that tight. Doesn't hurt, does it?
No.
Okay, open your mouth for me a little bit. Might be a little tender, but okay, open your mouth. Good, a lot better. Shut it. Okay, now look, Nat, come here. I want her to open up her mouth as much as you can. Shut it. Do it as much as you can. That's a lot better than when she first walked in. So that's good. So she's already got better mobility into the jaw. I'm going to give her some exercises to do which will help her when she's not here. Now we're going to adjust her neck. So lay on your back for me. Now come on down here. Okay, reason we're adjusting the neck. All the muscles from this area go up into the back of the neck, go into that lower part of the jaw. So we're going to adjust this. Can we just relax your head? Mm-hmm. Adjust this other side. Good, relax. And we're just going to traction out her neck. After this, we're going to put her on, you can sit up for me, we're going to put her on a little bit of cervical traction, which will help to adjust everything. And like I said, in the next week or 2, 3, I'm going to show you some exercises and tips that you can do at home to help when you wake up with a stiff jaw or you can't move your mouth well, and you'll see if that helps you on your own. If it doesn't, then you can go to see somebody. Also, if this does not get better over the next few weeks or it starts to act a little bit stubborn, what we'll do is we can also dry needle it. And those are needles that we put in there to help break up the tight muscles. You can look at some other videos. I don't have any on the jaw yet, but you can see where we do it to other parts of the body. But show them how much better you can open your mouth. That's significant than when she first came in. So look, it was good being with everybody today. Please subscribe to my YouTube channel. Remember, pain is not a lifestyle. We'll see you next week for another video. Have a good one.